Virologists have expressed concerns about the influenza season. This may result in more people needing medical care for flu, including hospitalisation, whilst the health system is still battling the coronavirus. So both COVID-19 and the flu are respiratory illnesses. Research so far indicates that COVID-19 spreads more easily and has a higher death rate than your normal flu. To help us understand this better, we now joined on the line by Dr Ahmed Cassim. And Dr Cassim is the general practitioner, and as I said, he joins me now live on the line. Good afternoon to you, Doc. Thank you so much for joining us here on the SABC News channel. So, as I said on my introduction, typical flu symptoms include your fever, cough, sore throat, muscle aches, headaches, and fatigue. So, talk to us about the severity of flu if one actually has the flu and not COVID-19, because a lot of people seem to panic a bit when they have those signs.
In the beginning, it's very difficult to differentiate the two because the symptoms are more or less the same. As you said, fever, sore throat, cough, generalized body pain. But with the flu, once you treat it, it resolves. While the COVID-19 continues, the fever gets higher, and the other symptoms like the sore throat, the cough gets worse, and then you start getting respiratory symptoms, the shortness of breath, and which is eventually to pneumonia, and also sometimes you get gastro symptoms like diarrhea and vomiting and that. Mm-hmm. And then, of course, you have to do a COVID-19 test, and that will differentiate between the flu and the COVID-19.
But from what you're telling us on the surface, COVID-19 looks a bit similar to the seasonal flu from what you say. So I suppose it's always best for one to go get checked if they suspect that it may not just be any ordinary flu.
Yeah. In the beginning, it's very difficult, as I said, to differentiate. If a patient comes to the surgery and he says, look, I've got a runny nose, I've got a cough, I've got body pains, I've got fever. You can't just, say, all right, you got COVID-19. You have to, as a clinician, you have to make a choice. Is not too bad. The temperature, his fever is below 38 or below 39. You can say, all right, I'm going to treat him with, antibiotics and antihistamines and that. And then see and tell him if it doesn't resolve in 2 or 3 days, then he must contact the doctor and tell him, and then the doctor can decide whether a test must be done or not.
So scientific research shows that COVID-19 is more dangerous than influenza. I mean, we even have the stats to prove that here in the country. Dr. Cassim, share with us your insights regarding this particular issue.
Yeah, you see, of course, with COVID-19, the symptoms are more severe, and all COVID-19 patients who are positive, are not hospitalized, and some have to be treated at home, isolated, for 7 to 14 days, depending on the symptoms. Some symptoms are not very severe, and some people who are tested positive are also asymptomatic. So you have to just listen and ask them to tell you whether things are getting worse. And if things are getting worse, like as I said, especially with the chest problems, some lead to pneumonia and with severe gastro, they can become dehydrated, and then they have to be hospitalized. And those are the people who can succumb, to this COVID-19, and also those people who have comorbidities like hypertension, diabetes, asthma, TB, HIV. So they are all very, very high risk for this particular COVID-19 pandemic.
So we do know that we've been hit by the cold front from Friday. It's been very freezing in Johannesburg, for example, and the influenza season is fast approaching as well. Is it recommended now for one to get that a flu vaccine, given that, as I said, we've been experiencing severe cold in the country?
Yeah, see, the flu vaccine, remember, if you take a flu vaccine, it doesn't work immediately. A lot of people should have taken the flu vaccines a month or 6 weeks ago, because the flu vaccine takes a few weeks to work in. So people taking flu vaccines now, when the cold front is there, it's not that they mustn't take it, but it doesn't work. A lot of people think you take a flu vaccine today, and like tomorrow or within a day or two, it's effective in your system. So a flu vaccine takes a while before it also sets in.
All right, Dr. Cassim, that's where we leave it. Thank you so much for coming through. That's Dr. Ahmed Cassim. He is a general practitioner talking to us about COVID-19 versus your normal influenza and how we can go about getting ourselves against cold. As I said, that the influenza season is fast approaching. All right, so let's just go back to the story in Eersterust, Highlands Park to be precise. That is where reporter Mulemo Nemutwa is. So, Mulemo, you got cut off whilst the neighbor was still busy explaining what might have transpired last night.
Yes, Palisa, whilst the concerns over